What's up, guys? Dr. Nicole. Happy Monday. Hope you are kicking ass and taking names this week. We are in the second full week of the new year. So it's still the new year, you guys. There's still time to execute and make changes and do the things you want to do for 2019. I just got off the phone with one of my fellow mastermind attendees, participants, and she's doing a webinar and she works with dancers and she's talking about how important the core is for X, Y, and Z. And we started talking about some of the similarities that we train with breathing and the pelvic floor and the core and what I'm starting to call the pelvic core. And I thought, oh my God, it's so important for dancers. And I realized every single client we see would benefit from and needs a pelvic core screen. And there are a million reasons why, but today I want to talk about the top 3. And this applies to all of your clients, no matter what setting you're working in. If you work in an orthopedic clinic, if you work in the spine clinic, if you work with athletes, if you're working in post-surgical, rehab, neuro, maybe not pediatrics, okay? Although I think it's very common to see pelvic floor dysfunction in children and it gets missed and there is treatment. So, I would put that at the last type of client that would definitely benefit from some screening questions and a general screen that doesn't involve anything internal. So every single patient, client in every setting can essentially benefit from a screen. And I'm going to tell you why. So with every ADL and instrumental ADL, activities of daily living, there is a change in intra-abdominal pressure. If you think about getting out of bed, getting out of a chair, going to the bathroom, sex is considered an instrumental ADL. Putting on your socks, feeding yourself, dressing, bathing, everything goes along with a change in the intra-abdominal pressure. And one of the most important things, aside from the basics of keeping your organs and your urine and your feces inside of your body and then letting it out when it's time, the urine and the feces, a really important job of the pelvic floor, aside from that, is to respond to those changes in intra-abdominal pressure. And if the pelvic floor isn't doing its job and the pelvic core isn't working together as a team, then you're going to see some deficits that maybe you might not be able to identify other places. So it's really important, no matter how you're thinking of what's going on with this client and what their goals are, be aware that their ADLs can be impacted in some way with what you're working with, and their instrumental ADLs, and that their pelvic floor is going to play a huge role, and their pelvic core is going to play a huge role in how their body responds to and generates that intra-abdominal pressure. Secondly, we generate a lot of force from the pelvic floor and the pelvic core. The pelvic floor, again, responds to those changes in intra-abdominal pressure, and the pelvic core helps generate the changes in the intra-abdominal pressure. And those structures need to be able to coordinate and work appropriately to generate and respond to those forces. So again, there could be something going on that you might not be able to see with your traditional screens because you're not thinking about the whole body that way. Finally, it could be the missing link, just like I talked about with changes in intra-abdominal pressure and generating force. The pelvic floor and the pelvic core are very important for that. But there could be other things going on that will impact that client's outcomes and their participation in the process, as well as their willingness and commitment to the home exercises. So and I saw this a lot of times, is that if I wasn't really asking people questions that mattered to their goals and how they were impacted, then they wouldn't do their exercises. And I think this is a real key thing. If we're asking someone to do something that can cause pain or incontinence or issues with prolapse or causes them a sensation of feeling unsteady down there, they're probably not going to tell you. They're just not going to do it. So they're going to be frustrated and they're going to feel like there's something wrong with them because you're not bringing it up. And you're going to be frustrated because they're not doing their exercises and they're not getting better. So I think it's really important for us to start asking these questions to people, knowing that it impacts them because of the changes in intra-abdominal pressure and the ability to generate force and the ability to help them do those ADLs, as well as the ability for them to carry out their exercises and get the outcomes that they desire. What's up, Brian? So it's really important to screen the pelvic floor and screen the pelvic core, even if you're simply asking questions to them so that you can find these barriers that we keep identifying and help break some of those barriers down so that you can get to the core of the issue. How you doing, Brian? You can get to the core of the issue so that you're not getting a disconnect with people dropping off or not doing their exercises or not getting the outcomes that you both want for them. So thinking about it from that whole sort of comprehensive approach, hence complete PT, it really can help you kind of think about it in a different way and talk to your clients about function in a different way, because the pelvic floor and because the pelvic core do such an important job for generating force. Even something like standing at the kitchen and reaching overhead is going to require them the ability to generate intra-abdominal pressure increases and respond to that so that the force can go from here and down here up. And if we're not thinking about it, if we're just thinking mechanically from the shoulder, we're going to be missing a big piece. So you can see how it's not just your patients who are reporting incontinence that need a pelvic floor and a pelvic core screen. So hopefully that makes sense. This is why I created the 7 questions, my free ebook, because I think this is like the very, very start of beginning to sort of go through and dig out what's important for people, for our clients. CompletePhysicalTherapist.com. I can put the link in the comments, is how you get the free ebook with the questions and a general script of how to ask it. That's like the number one place that I recommend people to start with, is start asking questions. And let me know what kind of responses you're getting. At first, you might not get a lot of people who are self-reporting or who are responding. But what you might start to notice is that people open up to you when you start asking them about it. Especially if there's just some missing piece that's going on. They're not doing their exercises. They're dropping off. They're not getting the outcomes they want. There might be something that they don't know how to tell you, or that they're not really aware of themselves. So I highly recommend clinicians to get the free ebook because it's the simplest place to start, and it can help kind of open your eyes to what else you might be able to assess and do. So I'll just quickly summarize the top 3 reasons why every client needs a pelvic core screen. They need the ability, every activity of daily living and instrumental activity of daily living requires a change in intra-abdominal pressure, which coincides with the ability of the pelvic floor and the pelvic core to generate and respond to that pressure. And then finally, there might be something they're not telling you as to their participation in their therapy, doing their exercises, attending, doing the things you're asking them to do because you want to get them better. And then those outcomes ultimately, is there something going on that you guys are not working on together that could be the missing link? All right, you guys, I hope that was helpful in some way. No matter what setting you're in, no matter what type of clientele you're working with, athletic, ortho, neuro, rehab, post-surgical, they all kind of surround around these top 3 things: intra-abdominal pressure generating forces, responding to them, talking about the real nitty-gritty stuff. So yeah, hopefully that's helpful. Let me know, comment below if this is all starting to kind of make sense to you in some way, what other questions you might have. I'll put the link in the comments to the free ebook for you guys. Yeah, and just let me know what's going on, what other questions you have. And I will talk to you soon. I'm going to go see why my dog is having a conniption fit. All right, peace.